Sarah Bramley, and I'm really happy to be here. I'm Chief Impact Officer for Water for People, and I would like to invite up a really incredible group of folks working on WASH in communities. And so without further ado, I will invite Sherry. Sherry Bradley is the Executive Director of the Black Belt Unincorporated Wastewater Program, which was founded out of a need to help low-income families who could not afford a wastewater disposal system. She is the former director of the Bureau of Environmental Services with the Alabama Department of Public Health, and has been a public servant for 45 years, which I cannot believe.
Oh, yeah.
Excellent. Thanks, Sherry. Next up, I would love to invite Sharon. Sharon Groves founded YES. YES stands for Youth Empowered Services and Solutions. So the full name is YES of Charles County. Charles County, for those who aren't local, is about 40 miles east of here. And so Sherry works in Charles County. YES is a nonprofit organization dedicated to serving at-risk youth and youth living in poverty. Sharon is a disabled veteran who has served honorably in the United States Coast Guard. And in 2017, she also opened a temporary shelter, Sonia's House, to establish and strengthen community-based programs for runaway and homeless, sexually exploited girls and their families. And we're not going to talk about that a whole lot today, but if you have an opportunity, please talk with her because it's really interesting work.
Good morning.
Next up, I would like to invite Kyle. Kyle Jones is the Policy Director for the Community Water Center. Prior to joining CWC, Kyle was an associate attorney practicing environmental law, land use law, and local government advocacy, including working and litigating under the California Environmental Quality Act. Prior to that, Kyle served as a policy associate for the Sierra Club of California. Welcome, Kyle. And last but certainly not least, please join us, Crystal. Crystal Tulley-Cordova is a principal hydrologist in the Navajo Nation, Department of Water Resources, in the Water Management Branch. She is an enrolled member of the Navajo Nation. Crystal works on developing regional water infrastructure projects and securing water rights for the Navajo Nation. She was awarded the American Indian Science and Engineering Society Professional of the Year Award, and also the University of Arizona Agnes C. Nelms Hari Tribal Resilience Leadership Award. Congratulations.
Thank you.
So this is an incredible group of people, and I'm really excited to have a conversation with you all. Water for People works internationally. As some of us heard Mark say last night, we've been around for 33 years working in now 9 countries around the world. We've recently turned our focus to domestic work as well. And the reason why we've done that is we recognize that when we talk about the sustainability goal number 6, access to water and sanitation for all, that means all. And that means that we need to also be thinking about what it takes to ensure that people in our own neighborhoods are also enjoying their right to water and sanitation. And so we have talked yesterday, and we had a great plenary yesterday, laying the groundwork, thinking about some of the challenges in this space and some of the solutions in this space. Today we're going to turn our focus to think more about some of the voices that are coming from the communities where we're working. And so with that, we've got a series of questions, 2 rounds of questions, and then hopefully a lightning round at the end. And I'll start with the first one.
Oh, okay.
So our first question, I've got to flip my page. All right. Our first question, so Sherry, you live in Alabama, where you've seen folks flush wastewater into their own backyards or local water sources because they have no other option. Can you chat through your community's experience in the wastewater access gap and some of the risks that so many people face across the South?
At first, when I heard of straight piping, where a person has a PVC pipe from their house, and when they flush the toilet, the sewage goes on the ground. I really didn't believe it until I started working in the field, and it's true. But now, what got me is that what's the solution? We do have a solution. The two things that are driving this, though, one is poverty. The second is the type of soil that we have to work with. This is called black belt soil. That's the soil type, black belt. And it's called belt because when you look at Alabama, it's right across the county is right across the middle. So we have come up with a solution in that we receive grant funding, but we also use an advanced treatment unit called FujiClean USA. And on some of those installs, there are no field lines because the ATU actually cleans up the effluent. But let's go back, looking at the people themselves. There's environmental problems we know, causing health problems. But y'all, there are also psychological problems. When you go for so long without being able to, if you have a septic tank system, you flush it, and it comes back in your house when it rains, psychologically, even now with a septic tank system, they will not flush that toilet when it rains. They would not put toilet tissue down the toilet. They will burn it. So I look at that and I wonder what can I do about it, but time would take care of that. Education would take care of that. I'm not going to go too far. I'll stop. She told me I had 5 minutes.
I love when panelists self-moderate. Thank you, Sherry. No, that was a really terrific introduction. And I think that some of what we heard is some of the behaviors and coping mechanisms that people build for themselves, some of the resilience that they build, and also some of the solutions that they begin to find for their own spaces. And I look forward to, in our next round, hearing a bit more about what kinds of things you're seeing. Thank you very much. Crystal, we're going to go all to the other end of the stage. Crystal, individuals on the Navajo Nation are 60 times more likely to lack access to wash services than the average person living in the United States. Can you talk to us a little bit about what life is like inside the water access gap? How do members of your community adjust to or work around limited access to drinking water?
Answering that question, it's important for me to think about my first water memory. So I grew up as a water hauler, and many people turned on their shower this morning, maybe waiting for the hot water to come online. And when I think about that, I think about my earliest water memory. I was probably around 3 years old. I live in a multi-generational household with my maternal side of the family. My dad was taking care of us there because my mom was in a master's program at the University of Utah in social work. And I can remember waiting. I seen a big silver wash pan, and on the stove, not too far away, was boiling water. And that boiling water was to be able to add to the silver wash basin so that I could bathe. And, that's my earliest water memory. But before doing that, you have to have these large barrels that you siphon water out of in order to put into the kettle that you would be heating up water in. And, the same practice is also for washing dishes. And, I many people may look at me and say, well, I thought that was my parents' generation. I thought that was my grandparents' generation, or even my great-grandparents' generation. But I have, nieces and nephews that's still their current livelihood. And, one of the things that we are is we're resilient. And so the opportunities that have come to be able to access water, especially during COVID, was a challenge, especially when the early messaging got out that you need to be able to wash everything down and you need to wash your hands more often. That was a challenge for water haulers. And I know, at one point, Navajo Nation was the largest per capita in the United States. And when we think about that, there was opportunities to be able to have closer watering points. There was partnerships with CARES Act funding that provided those watering points in closer areas. Through the Indian Health Service, there were transitional water points that were built in communities that didn't previously have an existing watering point. But when you think about where I got water, I've taken some people there from the media before, and I didn't know, but before coming a water expert, that there's regulated water and unregulated water. Like the watering source that we use was a livestock well, and it's good tasting water. And when you look at it, I mean, it looks like this water here today. That's how the water looks from the livestock well. And so, how do you not know, not being a water expert, that there may be contaminants in there that don't meet the drinking water level? And I think, when we think about things of water access, there's definitely challenges associated with the sanitation facilities in the home as well. And I look forward to telling you about the solutions we're working on, because there's a lot of good work going on in the Navajo Nation now to be able to secure water and help close the clean water access gap in the near future. And then we also have proposed projects for that long-term future so that we can provide that security and sustainability for our people.
Thank you so much, Crystal. I really appreciate you talking about your first water memory and really framing the conversation that way. As you were talking, I was thinking about my first water memory. I would actually challenge everyone in the audience to think about your own and kind of what that looks like and how it looks similar or different to Crystal's story. Thank you, Crystal. Kyle, you're next. Kyle, each year, over 1 million Californians are exposed to unsafe drinking water from taps in their homes, schools, churches, parks, the places where people are. What communities are most affected by this crisis, and what specific challenges do they face?
Where Community Water Center works, we started in Tulare County, California. I don't know how many folks here are familiar with Tulare County, California. There's more cows than people. It is the agricultural heartland of California, and so the communities that we work in organizing around who are most impacted tend to be low-income Latino farm workers who have been systemically marginalized and oppressed. And in Tulare County specifically, we have a lot of communities that we work with that are very close to other communities that have decent sources of water. But through redlining and other mechanisms, they were not allowed to live in those communities to get the benefit of previous investments and to have built-out water systems that I think we all expect today. The 1970 Tulare County General Plan actually listed, I believe, 16 communities as non-viable, without any future, and not worthy of investment. And so those are the communities that we started door knocking and organizing around. That language, it wasn't taken out of the general plan until 2006, which is just shocking to me. And so for life on the ground, a lot of these communities, because of the agricultural region that they are in, it's contaminated by nitrates. Nitrate contamination, you can't taste it, you can't smell it, you can't see it, but it has particularly hard health impacts on children, especially. That's where we get issues like blue baby syndrome, where children are unable to actually take in oxygen that they need to survive. Another contaminant that we're dealing with, so it's not just drinking water, is 1,2,3-TCP. That was essentially a byproduct that was put into pesticides because the chemical companies needed to get rid of it somehow, and they felt that was the cheapest way to do that. That got into the groundwater, and what's particularly harsh about that one is it's a carcinogen. It's not just activated by drinking it, but by inhalation, and so residents can't even take hot showers without worry about getting sick. So the work we've done is really work to organize those residents who have been impacted, who knew something was wrong with their water, but that they didn't trust their water, but work to get them understanding what is in their water and to fight for a better future. So then we since expanded to the Central Coast of California near Monterey County. If folks have been to the aquarium there, just about 15, 20 minutes out. A lot of rural communities, farm worker communities, also suffering with these issues. And so, we are working to help organize, educate, and make sure that people are able to get access to water that they deserve.
Thanks, Kyle. I think we begin to hear some similar themes coming through in terms of how do people trust their infrastructure? How do they trust what's coming out of their pipes or the pipes that they have in their homes? And that's a really interesting part of the component, I think. Thank you. Sharon, Charles County, again, just 40 miles away from here, faces a unique polarity between wealthy and low-income communities. Can you discuss how this impacts water and sanitation challenges for the people living in Nanjemoy?
Well, Charles County, some people may be familiar with Charles County. It's now been slated as the wealthiest county in the nation for African Americans. And it was Prince George's, but in the last maybe 10 years, there's been this huge migration of people to come into the county, where people are buying townhomes upwards of $600,000. But the county has a lot of very poor pockets. And in Nanjemoy, it's further down in the southwestern part of the county. So many people don't know about Nanjemoy unless they've read about it and they intend to buy property there, or they've been familiar with it, because we have huge disparities and huge wealth gaps in Charles County. We've got some of the descendants of the Mudd family. The Mudd family, that was the family that harbored Booth after he shot Lincoln at the theater. Their family is in that community. The Mudd family is in that community. But then you have huge sprawling homes on the water because it's a peninsula. It's all water property. And then you have people who live, like Mr. Johnson. He lives in 2 outhouses that he has put together to create a structure for himself. So the children who live in these communities where you can go and they call like the valley, and these little coves down in places where everybody's got either like a porta potty in the front yard that most people are sharing. And then the children are affected by this because sometimes the girls don't go to school when when they have special times when they need water the most, and it affects education, and it affects the next generation, and it affects their ability to earn and to move forward. And then you have people who are Rhodes Scholars, and they're traveling all over the world, and they have very powerful positions, and you just don't know that those other people are there. There are health issues, unintended health consequences, like she was talking about, especially psychological. But hand, foot, and mouth disease just goes rampant down there whenever it gets ready, and nobody's heard of that. Nobody's dealt with hand, foot, and mouth disease. It's like astonishing. But COVID almost, decimated the community. But we have some of our county officials even living in Nanjemoy. Very wealthy people, beautiful homes in beachside communities. And then there are people who are tucked back in places that you can't access when it rains because it washes out the road, or back in places where you don't know they're there because they rarely come out, and it's a closed community, and trust is a serious issue. They don't trust people, so they don't come out. You don't know they're back there. They also don't want you to know how they're living because their homes can be condemned, or their children can be removed from the home. But this, the wealth gap is astonishing. It really is. Some people that a lot of folks that have moved into this county in the last maybe 15 years, they don't even know that these places exist. So I've been working in that community for 24 years, so I've gotten to know. Basically, it's a community of about maybe upwards of 3,800 people. So I've gotten to know plenty of those people.
Thanks, Sharon. I think that one of the final things you said is the people who other people don't know exist is a big part of what we're talking about, and why it's important for us to be able to have conversations like this. Because I think that still a majority of folks within the United States don't recognize who the people are who don't have access to water and sanitation, that there are people who don't have access to water and sanitation, that they and that they're not far away, that they're not tucked out someplace miles and miles. It's sometimes very, very close. So I really appreciate you all sharing some of what the faces and stories of people that you're working with look like. I think it's important for us to all be able to hear. In our second round of questions, I'm going to ask a question to two people at a time. And my hope is that we can have a little bit of a conversation between folks. So it's maybe not just down the row. So the first question is to Crystal and Sharon. Communities like yours, which have faced ongoing issues like this for decades, have developed locally led strategies to address these challenges head on. Crystal began to talk about that a little bit in your first answer. What solutions have your own communities developed to address these gaps successfully? So I don't know, who wants to start? Crystal's getting ready.
I'll go ahead and start. The Navajo Nation has a number of projects. We have a number of partners that we're working with to be able to close the clean water access gap, at least move it a little more in the near future. And those partners include entities like Dig Deep, working on cistern and septic projects. We also have the Indian Health Service that is working on projects as well. And so after CARES, there was American Rescue Plan Act funding, as well as Infrastructure Investment and Jobs Act funding. And that funding today is assisting with project development. We're using our ARPA dollars to be able to work on water projects in various communities throughout the Navajo Nation. If you don't know anything about the Navajo Nation, it's 27,000 square miles, similar in size to the country of Ireland or West Virginia, the state of West Virginia. And we're building projects across Utah, Arizona, New Mexico with those ARPA fundings that were given to the Navajo Nation government to be able to use that money. And then through our partners like the Indian Health Service, they're under the Infrastructure Investment and Jobs Act, there's projects being built that are on the Indian Health Service Sanitation Deficiency System projects listing. And so those are great projects that are being built. The other thing that I wanted to touch on are water rights projects, because under the Infrastructure Investment and Jobs Act funding, our Navajo Nation did have a Navajo Gallup water supply project that was authorized under Public Law 111-11. And that project is being built so that we can diversify our water portfolio. So historically, the Navajo Nation has really relied upon groundwater, but through water rights, we have the opportunity to be able to include surface water from the San Juan River. And we now have on the eastern side of Navajo, 8 Navajo communities serving over 7,500 people, water from the Cutter Reservoir. And then we are building the larger lateral called the San Juan Lateral. And that is to be able to take water off the San Juan River. And we're going to be repurposing a former intake that was used by the San Juan Generating Station. It was a coal burning fire plant, and we're now going to be using that as our intake for our drinking water source. And so that comes along down the Four Corners region. If you've ever seen Shiprock, if you haven't, it's a really cool igneous feature on the Navajo Nation. We're going to go southward to Gallup, and then we have laterals going to Crown Point, New Mexico, as well as Say Bonito, New Mexico. And our hope is that that water line can continue to the capital of the Navajo Nation in Arizona. We're working on 2 water rights settlements currently, the Northeastern Arizona Indian Water Rights Settlement, and that would provide the authorization for us to be able to take water into the state of Arizona, as well Arizona water that is authorized under that proposed water rights settlement, but then also be able to cross state boundaries. So Navajo Nation straddles the upper and lower Colorado River Basin. If you're familiar with the Colorado River, you know that it's managed in 2 distinct basins, and the challenge for Navajo Nation is being able to straddle that. So taking water from the upper basin to the lower basin is a challenge, but through water rights, we can be able to have the congressional authorization to take water, Navajo Nation water, that across the state boundaries as well as the watershed boundaries. And, you know, we have projects like the Navajo-Utah Water Rights Settlement that was settled 2 years ago that provides us the opportunity to build water projects across the Navajo-Utah region. When you look at the Arizona portion of the Navajo Nation, there's more than 200 homes in those 110 communities that don't have running water, and that's really a challenge. And we're through the funding that we've received, through the unprecedented time, CARES Act, ARPA, infrastructure investment, and then, now there's the IRA funding. That provides the opportunity to try and close the clean water access gap. But the challenge with that is that that money's there for everyone's towns, cities, states, counties, and there's a challenge with the capacity to be able to build all those projects by those funding guidelines that have been identified.
Thanks so much, Crystal. And I really appreciate how you have wove together solutions that are happening locally and how that has provided evidence and structure and input towards some of the national level policies as well, and how those things have to be really intertwined in order to make full solutions. I really appreciate that. So Sharon, what kinds of solutions are you seeing in Charles County? What are people in Nanjemoy doing?
Unfortunately, I don't have that story. Each time I come to a conference, I hear people talking about the projects that they're involved in and what they're doing, and some of the accomplishments. I've been. What I would do is take people that I would meet that I thought could make a difference and take them to Nanjemoy for community visit and say, look, and some of the people, oh my gosh, but they already knew. I was the only one that didn't know that they knew. So everybody knows about the problem, but there haven't been solutions. I think that I didn't even know water was so big. I had no idea how the problem could be solved, but I thought that the county government just wasn't doing enough. So there were no solutions. There weren't people working towards trying to solve the problem. So I would just do things that I can do independently and individually, like try to get people to donate water, or I'm making sure that I'm involved in that community doing various things. It just so happens, though, there's a silver lining, because I had a young lady that works with me, and I took her to Nanjemoy to show her the community, and she made a call to Earth Justice. And Emma, I think her name is Emma, I can't remember right now, Anna, she made a call to different people, and over maybe the course of a year, we were having all these Zoom calls. And so she put me in contact with different organizations, U.S. Water Alliance, University of North Carolina, EPA. So they said, well, why don't you write for this grant, the EJ CPS grant, and let's see if we can get awarded some funding to start looking at the scope of the problem and mapping this community out, right? So I was awarded the grant, which got me in touch with all of these different organizations, because I had no idea how this problem could be solved. No one agency can solve this problem. And I don't think the county knew what to do. So they did what people do, and they can't figure out how to help people, especially marginalized people. They blame them for it and say, oh, they like it. Leave those people alone. They like living like that. Well, they didn't see any change. And if you can't miss what you never had, so they're accustomed to living that way. They know how to survive, but there were no solutions. There may have been people who would come and try to get involved, and then they see the scope of the problem, and they realize there's really nothing they can do. So just pure being stubborn and determined, I just kept working over the years trying to figure out how someone could help me. I know nothing about water, but the women and one man on these different teams. Are they in here? No, just joking. It's a mighty team of women. They're brilliant. They know what they're doing. Mara is on the team. I can't brag enough about Aunt Mara over there, but they know what they're doing. So they have. Unfortunately, this will be the first real attempt to try to make a difference in that community, to try to bring sanitation and hydration to the community.
Well, congratulations on making it that far, and I think that speaks a lot to the persistence that's required as we are all working towards solution. One of the things that you said that really struck me was no one organization can do this on our own.
No way.
We have to work together. And that until relatively recently, you felt fairly alone in the wash sector. You didn't know that you were in the wash sector. And so part of what we're hoping to do in this space is to create more of that identity. So recognizing that there are lots of folks who are working on water and sanitation issues in the United States, so that we have resources together and hopefully can begin to matchmake some, learn from one another, and to share solutions. So I'm glad that you're here.
Thank you.
Our next question I want to send to Sherry and to Kyle. The Community Water Center and the Black Belt Unincorporated Wastewater Program have a unique lens working directly on building grassroots power, communications efforts, and advocacy. What have you each found to be the most successful tactics in bringing in new potential partners, including the government, to work to provide greater water and sanitation access to communities like yours?
Well, I'm like the others. We have 12 ladies. We call them the BBWP Community Service Corps. And we use peer consultants from right here in DC to put this together for me. But these ladies, they were trained, they heard all the same information, they were the same t-shirt, same bag, same information that's handed out, and they work in their respective communities, so the people know them. See, they didn't trust me at first. I mean, I would drive up, people would go in the house, I'd knock on the door, and they never would come out. But they trust their neighbor, someone they grew up with, go to church with. So these ladies are making a difference as far as getting the applications in to me so they can get a septic tank system. Now, I had said earlier about a psychological deal. I have people that won't even sign the application because they think you're gonna take their house or their land, and because it has happened to them before. So the group that we have, the Community Service Corps workers, they are making a huge difference. The incentive behind that is they get paid per application. So I get a lot of applications. That's one thing. The second thing that people see, they see BBWP working. It's working. What we're doing is working. But I have to say that Dr. Kevin White called one day and he said, Sherry, you're fixing the outside. What about the inside of the home? I said, well, what about it? I had no idea. He said, well, if the plumbing is not working, it's going to affect the septic tank system. So we teamed up with Lixil and iWash, and once a year we have what we call a community plumbing challenge, where we hire the high school students. We've taught them how to go in and give the inside of the home an assessment to tell us what's working, what's not working, what faucets is leaking, and then Lix will come in and replace it for free. Well, I said for free, up to $100,000. They've donated. So we are putting the young people to work, and that's all over the town. That's workforce development. The first time we paid them $30 an hour because we had a hard time getting the kids. We don't have a problem now. We don't have a problem. So those two projects are working very well. And we've got a lot of other stuff. It's a lot of sad stories. I'm constantly having to fight local officials, and I'm not gonna, Dr. White, I'm not gonna sit here and play a pity party. I'm gonna get off of that, but I do want to tell you this story before I go, because it made a difference to me. I had an elderly lady call me, and she said, I need your help. She said, I need a septic tank system. Well, now, she was not from Lowndes County. All my money is earmarked for Lowndes County. And I said, well, what's wrong? She said, a young man came by and said that if I don't get a septic tank, I'm going to get locked up. And he told me he could put in this septic tank. She went and got all her money out her savings. He dug a hole, and that's what was left, the hole. No money and an empty hole. It was sad. So to me, I'm a fighter. So I'm here to fight for those that cannot fight for themselves. I was raised with 6 brothers that got beat up a lot. So I'm just telling you, in this business that we're in, we're on the grounds. Y'all, it doesn't happen overnight. We've been out there fighting for a while. but I dare you to come to me.
I will not.
Yeah, absolutely. I think it's a good mix of trust and advocacy and fighting. A lot of the communities we work in, we work on consolidations because that is the easiest way to provide water, because there is usually a community nearby that can provide it. But again, like I said, there's a reason these communities are separate. There's a reason we have Porterville and East Porterville and Orosi and East Orosi, and you can't just build trust to break that gap down. Sometimes you have to empower residents to be advocates for themselves as well. So we work alongside La Asociación de Gente Unido por el Agua, the Agua Coalition. And these are activists that we've built trust with, who we meet with regularly, that we work hand in hand with to get things done. And in California, that looked like a lot of advocacy efforts. We passed the Human Right to Water law to get that recognition in law that this is what is happening on the ground is wrong, and that people were aware of it in Sacramento. And in 2019, we created the SAFER program, which was $1.3 billion over 10 years to help us organize communities around community-driven solutions. And it wasn't just like we had a lot of challenges with federal funding, right? You need a project, you need to be ready to go, you need to be shovel ready, because House members want to be in district with pictures and ribbon cuttings and all these things. But communities aren't there yet. They have problems they know that are wrong, and getting to solution takes time. It takes far too long. But in order to build trust and to break down some of these barriers, you have to organize and advocate. And so we were able to do that with a lot of this funding. There's still so many challenges. There's lawsuits. There's all these fights. But it's a good mix. You have to have your residents who trust you as an organization to provide it. You have to have either we do some engineering and technical assistance work ourselves, so we can do that. We partner with folks like Self-Help, with RCAC, who are able to provide some of those resources and help get towards projects designed. But then we still have to fight at the state level. We have to make sure that through the state revolving fund process, through the IUP, the intended use plans, that our projects are prioritized, that the funding is there. And right now it's a challenge. California was doing great. I loved, like 2 years ago, we had a $90-something billion surplus. It was fantastic. We were able to get an infrastructure allocation of $1.3 billion. And now we have somewhere around a $70 billion deficit. And so now we're worried about all these problems, these budget problems leading to a lack of funding. There's communities we work in, one in particular, it's called Johnson McGinnis Live Oak on the Central Coast, and it's not necessarily, in the Central Valley we tend to have more established communities. The Central Coast, I feel like it's just a couple streets here and there. So we've been organizing around there. It's a domestic well community. And for 2 years, I think folks have been knocking on doors, building relationships with residents, talking through what a consolidation project looks like. Like, yes, you're gonna pay a bill for the first time. You're not gonna have your well anymore necessarily, but here's why that's an improvement, because you're getting safer water. And unfortunately, because of the funding gaps we have, we're still having challenges to where, our state water board is kind of telling us, slow your roll. We may not have construction funding for this. And we just have to keep fighting, because we have that trust with residents, and once we have that, we can't lose it. We can't then say, nope, sorry, your project's too expensive, bye. We have to keep fighting to make sure that funding is available. And I think the bipartisan infrastructure law, IIJA, fantastic amount of funding. But I think it's nowhere near what we need. I feel like we have been starved for decades to get the resources we need into communities to be able to fund the infrastructure that are basic necessities. And so we're gonna need sustained funding, and to not say that a community is too expensive to help. We need to be able to get more money, more resources, and support these communities in getting their solutions that they need. And it's gonna have to be a much bigger investment in the future.
Thanks, Kyle. I think one of the things that's exciting to me is we asked 2 different questions to 4 different people, but there's a very similar theme coming through on creating citizen demand and people advocating on their own behalf for what they want and what they need. And then working to make connection with the services that are available. And so that kind of connecting role is a really important one. But it can only happen if people are advocating for themselves first. And I really appreciate how each of you spoke to that in your own way, and as appropriate within your own communities. All right, we are right on time for our lightning round. Well done, everyone. So the last question, and we'll just go down the line and each person can answer it. Our audience today consists of community leaders, government officials, researchers, technologists, WASH experts, and lots of great people in this room from various fields. If you were to leave them with one call to action for their own organizations, what do you want them to leave with?
Simple. Achieve hydration and sanitation through collaboration.
Teamwork. So
yeah.
Collaboration. I heard teamwork from Sherry.
Cannot do it alone. We need everybody in this room and beyond. That's the only way to achieve that. And it's easy to remember.
I love that. Thanks, Sharon.
Take the time and effort to create those partnerships, to co-create solutions. I know a lot of times that seems like a lot of investment, and we're always short on time, and we're always short on money, but the time and effort to be able to co-create solutions that are sustainable will last throughout a lifetime. And I know that we can do more together.
Oh, I love that. And I think that the recognition that the time is really well invested by creating that work together. Thank you. Kyle.
Yeah, I 100% agree. I think it's just keep building the relationships to push together towards a common goal. I think it's really easy to get disheartened in this town especially. Yeah. But we can't stop. There's too many people who are depending on the work we're all doing in the room to make sure that solutions are out there and funded and available. And so we just have to keep working together to fight.
Thanks, Kyle. Go ahead, Sherry.
And nobody can tell our story as good as we. When officials come to town, they need to contact us. A lot of times they don't. Okay.
I love that. And I think that we should leave it there. That I think is a terrific last word. But I will say, if there's anyone on the panel who would like to add anything more, we have a moment.
We have 3 minutes.
I think for me, it's really encouraging. I was a part of a convening that was just a room full of 30 people thinking about this day, and to see this room full of people, not only from NGOs and nonprofits and different entities, to be able to see our federal partners that we have, it makes a really great opportunity to be able to hear of the WASH challenges that are in the United States, and to be able to understand perspectives of what those challenges might be, but also more importantly, what those opportunities are. I know each of us within our different organizations know those challenges that exist, but I think as we have an understanding of the need, we can be able to work together toward that better future by being able to have solutions that are locally led that help close the clean water access gap here in America. And it's important because, every person in America shouldn't have to load a 50-gallon barrel to the back of their vehicle, or have a continuously sitting 250-gallon tank just so that they can haul water and try to look for a watering source. And I know that we have the opportunities, we have great minds in this room, and so let's move forward toward that better future.
Thank you, Crystal. And I think we will let Crystal close it out. Please give a big round of applause for this group. And with that, back over to Kabir and Emma.